No.
Acne usually begins between the ages of 10 and 13 and can persist for 5 to 10 years. However, it can also affect up to 25% of adults.
Now, Anna went to the Derma Laser Clinic in Blackrock in Dublin to discover what steps we can take to get it under control. Let's see how she got on.
Acne is just one of the misfortunes of adolescence, but for some it can continue into adult life, resulting in some cases in physical or emotional scarring. So just how do you treat it? Well, I'm here at the Derma Clinic in Blackrock to find out. Patricia, we talked to you before about tattoo removal and indeed the reduction of stretch marks. So today we're moving on to acne. Yes. And there's a huge percentage of the population who suffer from it, isn't there?
There is, and it seems to be on the increase, not alone just in teenage years, but in older people as well. Late onset acne is very, very common. The causes of it, really, it's difficult to pin it down to anything in particular, but the biggest influence would be hormones. Hormones have a huge influence on acne. And I do also think stress is related as well. Diet, it hasn't got as big an influence as we thought on any of the papers that have been written on it recently. Certainly if you have a bad diet, it's not great for your skin. But diet wouldn't be directly influencing acne.
Tell me, in milder cases of acne, what's the first steps to start getting rid of it or clearing it up?
Well, getting rid of it is probably something that we shouldn't say. With acne, we prefer to use the term about managing it because it's difficult to get rid of it, but it's certainly very, very manageable. And with mild acne, the most important thing is to try and reduce the bacterial count in the skin and to keep the skin as clean as possible so that bacteria just can't grow in it. And there are very simple, safe products that can be used to do that. And you can go for as gentle cleansers. Keeping the hands off the face is a huge one as well. The other incident that we have seen with men with mild acne is to stop using wet shaving, because all the blades nowadays have 3 to 4 to 5 blades and they're pulling the hair follicle right out over the skin, and if there's any bacteria on the skin, it's retracting back into the follicle and you're pulling the bacteria back down. So any men if we tell them to use a dry shave, go onto electric shave, the improvement is huge.
What about more severe cases? Obviously they're the ones that you tend to deal with, I suppose. What do people need to do?
Well, again, the principle is the same. We've got to get the bacterial count down, but we're dealing with oversecretion of the sebaceous gland as well. We're dealing with dead cells clogging up in the pores. So what we do is we put them on a regime, a very strict regime of our home care products that we would use here that are medical, and also then treatments within the clinic. And Clear Light would be one of them, which is a light treatment which destroys the bacteria. And then we look at, once we have the acne under control, then we look at doing other procedures like laser to remove any scarring. But there is no point in doing that until you've got the acne well under control.
So you have a willing volunteer today?
We do.
Okay, well let's go and meet him.
Okay.
Hello, Adam. You're very welcome to the Derma Clinic in Blackrock. Hello, how are you? Would you like to come inside?
Yeah.
We're going to start you on treatment for your acne. Okay, just want to go through with you what the process is and what we're going to do with you. So we're going to give you products to use at home, and also you're going to come into the clinic twice a week, just for 4 weeks, for a light treatment, which is going to destroy just the bacteria in your skin and help to clear up your skin as well. As we discussed before, acne, there isn't actually a cure for it, it's about managing it. So it's very important that you're using products that are going to really work on your skin every day. And the products that I'm going to get you to use are, it's called a Teen Clean Pack, but the principle and the main product in this is benzoyl peroxide. There's a wash, there's a medication, and then there's just a light moisturiser with a sunblock in it, because it's very important that you use a sunblock on your skin when you're using these products.
Adam, you're a brave lad to take part, and you're certainly not on your own, but I'm just wondering, what are you expecting out of this whole process?
Just clear my face up, just get rid of it. It's just annoying.
Yeah.
At times, just so it's easier even to shave, and just every day just easier.
Make life easier in general. Great, okay. Well, we'll let you get on with it. I won't delay you any further. Adam will undergo the pain-free Clear Light Acne system twice weekly for the next 4 weeks. And watch this space, we'll be checking back on Adam once his treatment is complete.